This is Jerry Hesch. I'm a physical therapist who works part-time in Henderson, Nevada, and developer of the Hesch method. See a small number of clients in Las Vegas, and I also do research, writing, and teaching. That's our website, and this is a really interesting email that I received today, and these pictures were taken a week apart, and I'm going to read the email. I taught a workshop last week, and one of the participants wrote me, and this is what it said. Hi Jerry, I just wanted to drop you a note and say thank you for the course last weekend and what you did for me personally. I've not had a headache since last weekend, which is amazing. I usually live on Advil. My headaches aren't disabling, but more of a sometimes near daily annoyance that I'm so happy to be rid of. ... Then she chatted about the workshop. And then she said, I worked on one of my kids, my 10-year-old son, and the results have been astounding to me. Justin has always had a lordotic posture and has always had difficulty running correctly. He could not correct his posture with verbal cues. He's never had any pain. He would run with an excessive heel strike, almost looking like he's leaping when running and exaggerating the pumping of his arms. He could not land on his midfoot or toes or with his foot directly under his hip and could not get a good push-off no matter what strategies I or his various coaches tried. On the treadmill, he would have difficulty picking up his feet enough, and they would be dragging and slapping during the swing phase. I've tried working on strengthening of his glutes and calves. His glute medius and max are weak, gastroc soleus lacks endurance, and poor balance going up on toes. Working on stretching his hip flexors, which were really only a little tight. Nothing really worked to improve his running or his posture, and I'm ashamed to admit I didn't really put it together till after your class. Despite all this, he is still a decent athlete and would somehow run a mile in under 8 minutes, even with his inefficient gait. Has very strong abdominals and a black belt in Taekwondo, but he could never get enough speed going to get a good sprint going in football or other sports. I took a look at him earlier in the week and found that he fit in the second most common pattern, plus lacked hip extension, only 0 degrees, and dorsiflexion and subtalar neutral. I think he had a posterior sacrum, but not enough confidence yet in what I'm feeling to be sure. I did the manual treatment and started him on the daily home exercise program. You can see in the attachment his posture before and his posture on day 3, a remarkable change. His balance is much improved also. Doing the nudge test to the sternum with his eyes closed, he was tumbling all over and now can hold his balance easily. We took a video of his running on the treadmill before and have yet to do the after video, but I've seen him running and can see it is already much better. But there is work to be done and habits to break, like the exaggerated arm pumping. I'll move into strengthening neck, glutes and calves, and run training. We'll get some video of him soon and try to figure out a way to send it to you. Let me know if you have any further suggestions on the running training. Thanks so much. I will keep in touch. Stacy. And I'm delighted, really happy to that she could take the workshop and develop skills in a 2-day period of time, such that she could make changes with her son. As you can see, certainly a lot of lordosis on that side, and on this on the after view, it certainly is reduced. You see a lot more of his back, and even the degree of elbow flexion seems reduced, if you'll notice that. And if you look at his legs, it just seems like he's much more relaxed on the second view, like there's a little bit of normative knee flexion. I don't know. It's subtle, but I feel like I can actually see the difference. It looks like his weight bearing is much more anterior. It looks like his hips are in hyperextension. And gosh, look at the difference in tone in his abdominal musculature. This is just by changing the posture, using low load, long duration mobilization. The other term is viscoelastic creep. And time is the key. Some of these stretches that she did were 5 minutes long. Some were 2 minutes long, and the other secret is treating it as a group pattern. In other words, not just doing one thing, such as just stretching the hamstrings or just strengthening the abdominals, but rather reducing the postural aberration and the hypomobilities that she found with him was a sequential pattern, such that she probably did about 10 different things sequentially with him. And so yes, it does take a little while, but you can see that the results can be had very, very quickly and very dramatically. That's all I'm going to say right now. Just delighted with this picture. I think I see a little bit of lengthening in his neck as well. And I will stop here. Hopefully we'll post a video soon. Thanks very much.